Okay, I'll meet you down there.
Hi.
Get my hair out. Okay. Yeah, very wet. Okay.
So welcome everyone to the Schwarzman Animal Medical Center. My name is Helen Irving. I'm the president and CEO of AMC, and I'm really privileged to welcome you all here today. What we are doing today is our leash cutting. We are opening on Monday a brand new surgical facility in honor of Denise and Michael Kellen Institute for Surgical Care. And this really is the first part of a complete transformation of AMC. We are renovating our hospital. It's a $125 million renovation, and it will put AMC back on the map as the state-of-the-art facility for the premier place of choice for the care for your animals. So with much more to say about that as we show you around, but you will see you're standing in the surgical suite. This is our anesthesia room. We have 5 state-of-the-art ORs with a minor procedure room and also a recovery area as well. We also have a central sterile unit downstairs. This is triple the size of what we actually have downstairs. And it will help enable us to further care for animals, certainly being a level 1 trauma center and a 24/7 surgical unit. So without much more to say about that, I think the people that you are here to see are our surgeons, and I'd like to introduce Pam Schwartz. She is the chair of our surgical department. Thank you.
Thank you, Helen. The surgical suite is one of the most important transformations in our renovation project, and something the surgery team has been looking forward to for quite some time. This state-of-the-art space is essential not only to provide the highest quality of care to our patients, but to ensure that we can meet the growing demands for our services, expand the possibilities for the care and treatment we can provide at the AMC, and attract the highest caliber clinicians to join our staff. I am personally thrilled to start working in this space, and my colleagues, many of whom are here with us, are equally excited to have this remarkable opportunity. As we move into the new surgical center, we are so grateful to the Kellen family who have made this a reality, and we cannot wait to get to work.
Thank you.
I'm going to be talking about Ollie, who's one of my patients here. If you can maybe come forward. I'm so happy that my patient Ollie and his owner Nancy can be here with us today from New Jersey. Ollie first came to see me after surgery elsewhere was unsuccessful to correct an excessive curvature in his front legs. He has a lot to say about it. I partnered with a specialist, Dr. Mike Carlin at Tufts University, on this highly specialized surgery. We were able to plan and perform the surgery on Ollie's right leg using a 3D computer model. Once we were happy with the outcome, we printed a 3D model of the bone and also cutting guides, which we use in surgery so that the surgery was performed exactly how we planned on it on our computer model. And I have those models, his before and afters, here today as well. Since his recovery, as you can see, Ollie's been doing great, and we plan to do a similar surgery for his left front leg later on this year. It's exciting to think that our new surgery center will allow us to help even more patients like Ollie.
Thank you.
I'd like to introduce Dr. Jonathan Ferrari, and he's going to talk about one of his patients.
Good afternoon. My name's Dr. Jonathan Ferrari, and I'm the service head of the surgical oncology service here. My team and I work to treat dogs and cats with cancer that need surgery, and in fact, as a single treatment, surgery cures more animals with cancer than any other cancer treatment alone. We work in close collaboration with our colleagues across the Schwarzman Animal Medical Center's Cancer Institute so that our patients can receive the most comprehensive cancer care possible through surgery, radiation, and chemotherapy. And it's exciting to think about all of the animals that we're going to be able to help here in our new surgical suite with our expanded capabilities. Today, I'm very happy that my patient Sherlock and his mom Stephanie are here. Thanks so much for coming. As you can see, Sherlock is an adorable Shih Tzu, and he underwent open chest surgery to remove a thymoma, or a tumor in his thymus gland, which is located in the chest. And Sherlock is now cancer-free, which is wonderful. Thank you. This type of cancer affects both dogs and cats and is best treated with surgery when possible, although other treatments exist if surgery is not an option. And fortunately for Sherlock, he had a tumor which could be removed through surgery. And he was a real trooper through his surgery, his hospitalization, and his post-operative recovery. And now, thanks to Stephanie's great care, we are performing scans to make sure that we're not seeing the tumor coming back. And fortunately, we're happy to say that there's no sign of that right now, and Sherlock's doing very well at home. And we're very glad to have this new surgical center to help patients who need major surgeries just like Sherlock. Thank you so much for coming.
Just a little bit of a tiptoe back here, but I'd like to introduce Dr. Daniel Spector, who is the head of our surgical residency program. You'll see beside me we have our colleagues from the NYPD, and they are a huge source of pride for AMC. We provide all of their medical care, and we see them pretty much every day, and they are a part of our family. And I'd like Dr. Spector just to introduce you to our colleagues here, and he can tell their stories.
Thank you very much, and thank you everyone for being here. I am Dr. Daniel Spector. I'm one of the surgeons as well as the head of the residency program here in surgery at the Schwarzman AMC. And so before we get into the patients, I just want to add the other aspect of this new facility that will be an incredible improvement and really expand our capabilities is the teaching that we do here, one of the missions that we have and we've always had as AMC was one of the first postgraduate educational facilities and institutions anywhere in the country. A very long time ago, we've continued that aspect. And with the capabilities in these new state-of-the-art operating rooms, we'll be able to really expand the breadth of our teaching as well as the incredible care that we can give here. And so that is one of the things that I'm most excited about as we move into our new facility. Before we get into our friends up here, we do have a single cat who is incredibly well behaved. I just want to point out Bear. Bear came to me just about a month ago, a little bit less or so. He was lucky enough to be rescued from a shelter in Philly by his amazing family, and was given a new lease on life, but he started coughing, and initially they thought it was just asthma until they noticed and found a tumor in his lung. That started to get progressively larger. And so with the capabilities that we have currently that will now be able to be even further expanded, we were able to minimally invasively through thoracoscopic surgery remove his lung tumor. And the benefit of that is he spent just a single night in the hospital, which especially for cats is a huge benefit. And you can see how well behaved and calm he is. He's keeping an eye on everyone up here. He's in his tie and he's doing remarkably well. And so he's a very, very special guy to all of us here. We're very appreciative that he's here today. And then, like Helen said, one of the incredible relationships that we have here as the Schwarzman AMC is with our friends and colleagues in the NYPD, taking care of all the different units, all the different canine units. And just two of our friends up here. We have Shaba right here next to me. And what Shaba had, and something that we do with our minimally invasive capabilities, is we actually do a procedure called a laparoscopic gastropexy. And that's tacking the stomach to the body wall internally, all minimally invasively with very small incisions. And what that does is it all but eliminates their chance of developing a GDV, a gastric dilatation and volvulus, and that's when the stomach twists and it's rapidly life-threatening. And so especially for our working dogs and our friends in the NYPD, this is an incredibly important procedure because of the importance of keeping us safe, all the work that they do, and all the incredible training that goes into getting these dogs out on the roads and out taking care of us. Not to mention the unbelievable relationship that we have with the handlers and they have with their dogs, which is one of my favorite things about working with the NYPD. And then Jake over there, Jake came to me similarly about a month ago, a little bit less, with something called a spontaneous pneumothorax, and that's when something happens in their lungs and they start to leak air into their chest. It causes the lungs to collapse in an emergent situation where they have a lot of difficulty breathing. And so Jake came in, he had a CAT scan. We worked with our emergency and critical care team to determine where in his lungs this blister had formed and ruptured. And so we were able to, through open chest surgery, we were able to go in and remove the offending lung lobe, the leaking lung lobe. And after a day or two in the hospital, he was able to go home. And after a hopefully brief layup from work, hopefully we'll be able to get him out, taking care of all of us again very, very shortly here. So I'm incredibly grateful that all of these guys are here. I'm really, really excited and looking forward to moving into our new space as well. And thank you again all for being here.
So we get ready, cameras? Ready?
Yep.
5, 4, 3, 2, 1.
This is a new leash on life.
Woo!